cloning is possible, do you think making a virus is impossible? I can make a bacteria more virulent, more aggressive in molecular biology. I designed several molecules because chloroquine was said to work. Hydroxychloroquine was also said to work. So I now designed other molecules. There's a way we do it from chloroquine and from hydroxychloroquine. And then I did a docking study on it. And I discovered that it can even do better than chloroquine on that COVID-19 virus.
Wow.
Yes. Hepatitis can be induced by a simple medication widely abused like paracetamol.
I thought it's a virus.
A lot of young women are actually struggling with their sex life, with their menstrual cycle, with their reproductive life because of the mistakes they've made with some of these after pills. Some of them are not meant to be taken more than once in a cycle. But I can tell you others take it multiple times. And they come with a complaint. I have not seen my period. I'm unable to take in, blah, blah, blah. The medications have tampered with their normal reproductive system. And it is tied to the uncontrollable taking of these pills.
Thank you for watching The Yellow Mic. My name is Kongs Shamaki. I'd like to invite you to help us reach 1,000 subscribers. We are striving to make this worth your time. Also, like this video and share to your friends, and let me know what you think in the comment section. Mr. Naruka Solomon Yakubu, you're welcome to the show.
Thank you.
Is it true that drugs must be taken with water? Can I take drugs with Fanta or Coke? Or yeah.
Well, thanks for that. Water is a universal solvent.
Okay.
We call it a universal solvent. The common man will always tell you, water no get enemy. So it's important you take your drugs with water.
Okay.
Why? Because it has the least content to distort the integrity of the drugs or what the drug will do, or to interfere with, the workability of the drug, what we intend the drug to deliver. Water is just water. But and it's just like telling someone, take your drugs with water. He was like, okay, but can I use a soft drink? Now, that's not water. It's liquid. When you add something to water, it is no longer water.
Okay.
So it means there is a possibility of that thing added to water to interfere even with the chemical nature of the drug.
Yeah.
So advisably, take it with water. But notwithstanding, there are some few drugs that we can like. These drugs work better in a high acidity environment.
Oh, wow.
So when you have such drug and the professional is sure of these drugs, he can like, okay, no, I don't mind. As far as this drug is concerned, do go ahead and take it with probably a particular soft drink because it contains some amount of acid that may aid probably in the absorption or dissolution or something that has to do with the drug. But generally, it's better to take it with water. The drug is good enough to deliver whatever it is meant to do without any other thing helping it. Talking about probably orthodox drugs.
Okay, when you say orthodox drug, what do you mean?
Drugs like paracetamol, drugs like flagyl, drugs like ibuprofen, painkillers, these are drugs you find all over the shelves. But, we can call some other things drugs because they are there to solve one or two things in the body.
Yes.
And in that place, in that field, in that sector, you may not necessarily have to take it with water.
Okay.
What am I trying to say? Let's go into things like the neem tree. the neem leaf.
tree. Okay, the neem leaf.
The Hausa people, I think they call it is it dogoyaro?
Yes, it's not so common here, is it?
It's not so common, but I think when growing up, it was almost everywhere.
Here?
Yes.
Wow.
It was almost everywhere. When I was growing up, it was almost everywhere,
Okay.
In the late 80s, early 90s, we see dogoyaro everywhere. There are less houses, but there are more trees around. Maybe people are yet to be rich, let me call it that way, to be buying everywhere and then building houses.
Yeah.
You may be advised based on what is known about the drug or about the plant to please don't use water.
Wow.
Use alcoholic, maybe drink. Use this solvent, but not water. Now, what makes the difference? The content that you want to extract from the leaf.
Yeah.
You may not find it in water extract. You may need another solvent to find it. And that's the secret of some of these our herbal remedies that we may not necessarily be aware of. So, do we need water to take our drugs? Yes. Can we use other things to take drugs apart from water? Yes.
Wow. So it all depends on what kind
It all depends on. But when you get to the hospital now in Nigeria, we are yet to integrate. We are yet to integrate, the herbal remedies, herbal drugs into our system.
Yeah.
So you are advisably, if you are not sure, please just use water.
What would you say is the difference between a pharmacist and a medical doctor in a hospital?
There is a wide and clear difference. Pharmacists are like priests when it comes to drugs.
Oh, so they administer drugs.
Being priest means when you get to the church, the priest has the final say.
Wow.
He hears directly from God, and whatever he tells you from the pulpit, it's done.
Wow.
So when it comes to the temple of drugs, the pharmacist
has the final say.
Has the final say.
Yeah.
Why? The doctors are trained specially to diagnose.
Wow.
And then to give a prescription based on what they believe is right. Now, they know you're having malaria. They give you a prescription based on what they diagnosed. Now, that prescription goes straight to the pharmacist. The pharmacist in a hospital, that's a hospital pharmacist now, looks at the folder, that's the file of the patient, looks at whatever that has been done to arrive at a conclusion that this person has, let's say, malaria. And then he looks at the age of the patient, looks at the history, looks at whatever that has now been prescribed, and he has the right to return back to the doctor with an advice based on the history you have taken, based on the symptoms that was captured, based on the patient complaint. I feel the patient will benefit from this instead of that. Now, why am I trying to say? Because the pharmacist is in a position to know how these drugs interact in all ramifications. You are just having malaria, but you are likely already a hypertensive patient. Oh, you are already a patient treating heart failure. You are already a patient treating diabetes. You are already a patient having renal failure, having kidney issues, having hepatitis. So you having malaria does not close the eyes of everyone against these morbidities, as we call it, against these diseases, as we call it. So that in the long run, you don't treat malaria and then escalate the issue of the liver.
Wow.
Because there are drugs that will give trouble to the liver when you are even having malaria. And there are drugs that will give some relief to the liver while still treating malaria. And that is why you have several brands, you have several classes, so to say, of anti-malaria drugs.
Yeah.
And usually you hear that there are different drugs for the same ailment. Now, they have their advantages, they have their disadvantages.
Yeah.
It's just like the way we know of the almighty, let me call it almighty chloroquine.
Yes.
Before now, we knew nothing about malaria but what? Chloroquine. As
Yeah.
long as you're going to treat malaria, you're
It's
going for
chloroquine.
chloroquine
I
tablets,
remember those
chloroquine
3 days
injections.
non-stop itching.
Very good. So, but you can see today you have a choice.
Yes.
Chloroquine may be so active, but we're like, hey, bro, I'm giving you chloroquine.
Mhm.
You're like, doc, I'm sorry. The malaria will go, but I'll end up having another different disease that will deal with me for more than 3 days.
Yeah.
I don't have to give you chloroquine as a doctor.
Hmm.
There should be something that should still deal with the malaria without necessarily giving you another disease.
Yeah.
So that's just the idea about.
Mm. So would you say, so it's not necessarily in the place of the doctor to prescribe drugs?
No, it is in the place of the doctor to prescribe. It doesn't mean that. I'm just saying when he prescribes, the pharmacist needs to
check it.
check it.
Wow.
Amazingly, if the doctor is wrong with the prescription and the pharmacist did not check it properly and he dispenses the drug, do you know who is going to be held responsible?
The pharmacist.
The pharmacist.
Wow.
Even though the initiator of the prescription is the doctor.
So regardless of whether the pharmacist works in the hospital where the doctor prescribed drugs?
Yes. Like, I run a community pharmacy, and I assume someone comes from a hospital with a prescription that could not be refilled in the hospital, and he walks into my community pharmacy. I am responsible for that prescription.
So you can alter some of those.
I can advise even the doctor right from the community. I can drop a note and explain to the patient based on what I understand.
Yeah.
I think the doctor needs to see the prescription again. And I'll drop a note behind the leaflets so that he goes back to the doctor, because it is for the safety of the patient. The patient is king, mind you. The doctor is there for the sake of the patient. The lab scientist is there for the sake of the patient. The nurses are there for the sake of the patient. The pharmacists are there for the sake of the patient. So the patient is king. We all collaborate to ensure that the patient gets the best.
And has the right to say no to.
And he has the right to say no. So even if the patient so believes in the doctor, so trusts, this is my doctor for the past 50 years. He has not done anything wrong with respect to prescription. And the pharmacist, under pressure, based on the wordings, based on the commitment the patient makes, and then vouching for, let's say, the doctor, and he dispenses the wrong medication, so to say, the pharmacist is held responsible.
Wow. And has it ever happened where a pharmacist was held responsible in Nigeria?
In Nigeria. I heard of cases.
Okay.
Yeah, I think I heard of one. And the pharmacist was sent to prison.
Wow.
I think for over 10 years or so.
In this country?
In this country.
Wow.
I just can't place my fingers on that particular case.
Wow.
The pharmacist, yes. The doctor gave, the right prescription was given, yes. But the dosage was wrong.
And that was the responsibility of the
pharmacist. And that was the responsibility of the pharmacist to know that the dose being given to this patient is too much.
Wow.
That was the point of intervention.
Let me ask a question. How do you come about dosage? What are some of those parameters you use to decide what dosage a patient is going to take?
Yeah, so many things come into play. These are standards already.
Okay.
Like when it gets to, I don't know if I should practically give certain drugs. Now, let me just mention drug A is being formulated, and the dosage of this drug A is given per kilogram. Okay. So there's a particular drug which I don't want to mention for the sake of safety. It is being given as at 3 milligram per kg.
Yeah.
And there are some that you may see between 30 to 50 milligram per kg. Others will give you a range. This drug is given on the first day, 3.2 milligram starts, then continue for the next 3-4 days at 1.6 milligram per kg. So now, these things should be with the pharmacist at his fingertips. There are some drugs that are so common that you don't need to go back to the books. You've practiced over and over again. If there is any review, that's why we go for conferences, we go for updates, we try to ensure that we are up to date with our knowledge base. So if such a medication is given, let's assume the one I'm talking about, 3 milligram per kg.
Yeah.
And then drug A was prescribed for the patient, and the patient turns out to be probably a baby, and the baby weighs 10 kilogram.
Okay. So weight comes into
yeah, that's per kg. That's the kilogram of the kg is talking about the weight of the
baby.
patient.
Okay, the patient. Oh.
So the patient now weighs 10 kilogram, and the drug, based on dosage, standardly is given 3 milligram per kg. So what dose in 24 hours now? What dose should be given to this patient? It means when you multiply 3 by 10, it gives you 30 milligram per kg within 24 hours.
Yeah.
And then the doctor probably, for one reason or another, you know, the way the hospitals have been choked with patients, you can imagine one doctor seeing over 200 patients. That can lead to not just tiredness, but fatigue.
I think a day, right?
In a day.
Wow.
So he may have been overwhelmed, and then he ended up giving this patient 300 milligram.
Wow.
By typographical error, by mistake, by he's human. He's human. And it comes to the desk of the pharmacist, and the pharmacist did not realize that the dosage of this drug is wrong. Imagine a baby that should take 30 milligram in 24 hours ended up swallowing 300 milligram in 24 hours. That baby may not survive it.
Wow.
Who is responsible?
The pharmacist.
The pharmacist.
Wow.
The doctor has done the job. He has done the diagnosis. He has given probably the right prescription, the right drug. But when screening the prescription, you should realize that, this dose is much.
So we have a lot of chemists around, some in the rural areas and a lot in the urban areas as well. And some of the people that work in these places are unschooled, untrained. What's the implication of that? And in your own estimation or experience, can you say these are some of those things that lead to, people just dying or coming down with certain ailments?
I'm into the academics. Sometimes you try not to make certain, as you don't make assertions if you don't have any research to back it up. But I can tell you from experience that quite a number of people die, not because they are not well treated, but sometimes just because of wrong dosages. And talking about patent medicine vendors around, they're everywhere. In fact, they are proliferating daily because the system, to some extent, has a way of accommodating them. I normally will say that why make so much laws to ensure that the pharmacist that is qualified to keep a community pharmacy. Now, there's a difference between a community pharmacy and a patent medicine vendor.
Okay.
There's a whole lot of difference. What's the difference? The pharmacist, registered under the law, qualified, is allowed to dispense almost anything called drug. Controlled, non-controlled, over the counter, and the rest.
Wow.
The patent medicine vendors, even though I've been licensed to operate in communities, whether rural or urban, they are supposed to be restricted. You shouldn't walk into a patent medicine store, wherever the location may be, and then you find certain drugs. No. No.
What kind?
That should have been in a pharmacy.
What kind of drugs should we find in a patent?
Quite a number. I don't know if this is open, but let me mention there are certain antibiotics.
Okay.
There are certain antibiotics that shouldn't be found in patent medicine store.
What are the implications and why?
The idea is that they are not qualified to handle such.
Oh, I see.
Be it from storage to dispensing to advice. The profession in pharmacy has a way of training you. It has a way of giving you an ideology. Your life is all about pharmacy. You are being made to see anything like a drug. You are so careful as a pharmacist can be. Now, some of these patent medicine vendor, what's the motivation? What's the true motivation? If we are going to be true to ourselves, quite a number of them are not out for the practice. Normally, if I'm going to greet my colleague, I will say, how is practice? I pay so much.
Yeah.
I pay so much with time and resources to be a pharmacist. So I can't just walk out here and just do anything because this is my lifeline. But what's the motivation for patent medicine vendors? I think one of the reasons why they were accommodated was because there are not enough pharmacists.
Yeah.
But you can see it as it is. I think I went to school 2001. I graduated 2007. I went back to have a master's degree. I graduated. I went back to have another master's degree. Now I'm doing my PhD. Now, what time do I have to make money? Now, a patent medicine vendor, all his life probably was just looking for money.
Yeah.
And he discovered that, there's another business that can give me more money. Medicine. Let me sell drugs. The pharmacist is trying to practice pharmacy.
Yeah.
The vendor is trying to sell drugs.
Do business.
So who is more dangerous to the society? Now they were accommodated so that at least people can make available these drugs, since we don't have enough pharmacists. But these people are out to make money. So how dare a vendor sees a prescription that he can barely screen and then tell you, okay, no, I'm not going to give you anything. Can you go back to the doctor? Mind you, he's there to just make money.
Yeah. So we have a number of problems in the drug industry, and one of those is fake medication in circulation. I know over the years, some commendable efforts have been made to curb that incident. But generally speaking, from your experience again, do you think we are making significant progress, or is it something just by the books?
You are putting words into my mouth. I've not worked with the regulatory bodies.
Okay.
I've not had any reasonable research or read through reasonable research. So let me speak as a citizen.
Okay. Who has
practiced over time.
Yeah.
Whom is living in Nigeria, and I'm still practicing and seeing things happen. I would say yes, we have made some progress, but we still have a long way to go. We still have a long way to go.
Yeah.
The problem of fake drugs is multifaceted. multifaceted.
Hmm.
Multifaceted. Right from the regulatory bodies themselves.
Yeah.
Now, as I said, I'm a community pharmacist.
Mm-hmm.
If the regulatory bodies do not stop these substandard medication
Yeah.
from coming into the country, people will have access to them. If the regulatory bodies do not ensure that whatever is in the market or is in the store is what they actually vouched for, what do we do? Now, the best I think we have done to ourselves is any drug that does not have a NAFDAC number
Registration, yes.
is fake.
Mm-hmm.
But is that all?
But even that can be fabricated.
And that I heard some people fabricate.
Yes.
So what do we do? It's good that yes, we are beginning to have companies that are having their that you can scan their drugs to tell you whether it is original
Yeah.
or fake. But there are others still in the market that the mama in the village, does she have an Android phone to scan what drug?
Or if you're sick, will you remember to scan?
And you discover that there are some hospital packs.
Yeah.
Like paracetamol, you can find paracetamol in hospital containers. Now you can't prove,
Yeah.
is it fake? Because it's not in a pack
Yes.
that you can even scan.
It was just counted. And
So what do you do? And there is a multi-dollar probably chains of businessmen that may sponsor this through. This is where poverty, socio-economic factor comes in. Those as regulators are being bombarded by these billionaires. Let's do business.
Yeah.
Yes, I have this medication. It's coming from England. So it is written. It's supposed to contain 500 milligram per tablet. But the regulatory body found that within the specification, probably we can condone 480 to 530. Now you checked and you discover that it failed the test. Probably you ended up getting 400.
Yeah.
That's substandard. And the person pushes you some dollars.
I mean, I've fallen victim of such buying fake medication, and beyond fake medication, also, I have seen situations where probably a foreign drug company was in the country manufacturing, let's say, for instance, medication for cold and catarrh.
Okay.
You take that and then it works effectively,
Okay.
but then after a while you hear that the drug company have folded up and they've left the country, and then there are certain imitations done in country or locally, wherever, and it promises to do the same thing, and then you take it and it doesn't. What will you say have happened? Is it that there are shortages in material? Could it be shortage in expertise, or is it just general compromise?
Well, it would be difficult to give it a straight answer, because when it comes to the working of drugs, a lot comes into be. For example, there are certain tablets you take.
Yeah.
Let me use the common tablets. There are certain tablets you take, something like paracetamol.
Yeah.
You discover that as you are trying to take the pill out of the blister pack, it breaks into pieces.
Yes.
So even the force of compression matters.
And that's a strong indicator that
There's an
something is wrong.
no, that can mean something is wrong. But the point I'm trying to make here generally is that there's supposed to be a check on the force of compression of each tablet,
Yeah.
the hardness of each tablet. There's what is called a binder. These are powders that are in particles. Something called a binder is supposed to put them together. It's like a gummy material. So you may discover that, okay, the gummy material used in A is different from the gummy material used in B. Now, not just being different because ordinarily, let's just put it together, and then when it gets into the body, it should disintegrate. Now, that gummy material, one of them may not be in a position to release the active ingredient as at when due, compared to the other. So, is it fake? Both of them contain the same amount of milligram. But you discover because of the change of one of the ingredients, the change of one of the non-active ingredients in the drug, it makes a whole lot of difference. Let me just practically give you an example. Maize.
Yeah.
Maize, the maize Maize is used as a bulky agent.
Okay.
You can use maize as a bulky agent. You can use Irish potato as a bulky agent.
Just to increase the quantity?
No, not necessarily to increase the quantity. Now, it serves like a vehicle. Like the paracetamol you see.
Yes.
White, right?
Yes.
That white thing you see is not the active ingredient.
Oh, wow.
You put the active ingredient in combination with what we call the bulky agent, which can be like the maize.
Wow.
Because the paracetamol itself is what gives it a bitter taste.
Yes. Thank you for bringing that point. Why must medicine be bitter? Especially Nigerian medicine.
What do you mean by Nigerian
medicine? Yes,
medicine?
because I've been to other parts of the world and the medicine is not as bitter as ours.
Okay. This still brings us back to the making. That's, in pharmacy, there's a course called Pharmaceutics.
Yes.
Pharmaceutical technology.
Yes.
Now, you discover that I can make my own medicine. I can still make the example of paracetamol. And I'll mask it so much that you can put it on your tongue, lick it.
Like a coating or something?
Yes.
Okay.
At a point, there's paracetamol capsule. I don't really see it around so much.
I've not seen that.
The idea is that the capsule now, you encapsulate the paracetamol inside so that you don't feel the bitterness.
Yeah. I think I would like something like that.
That is being done. The masking of the tastes of drug, it's something different on its own. As long as it will not affect the delivery of the drug.
Okay.
Companies are at liberty. But the more you do to present a tablet, probably the more expensive it becomes.
But how much does a capsule cost? I mean, it's just a coating, right?
But that's a raw material. Is it readily available? Okay. Is it sustainable?
Because honestly, I've seen Nigeria and Indian drugs, these two countries. Like if it's not bitter, it's not medicine. Right?
not all of them actually are that bitter. But as I said, the active ingredient of most of these drugs may not have a pleasant taste. And that is why you use some, like you can see when I talk about cornstarch.
Yes.
It's tasteless. Irish potato or sweet potato starch, these are tasteless. But when you check the prices of these starch, probably in the pharma industry, you discover that they are all different.
Yeah.
So which are you willing to use? And that's the question when some people will say, okay, if it is not paracetamol, If it's not Panadol, let me use that common language.
Yeah.
If it is not Panadol,
Yeah.
it is not Panadol.
Hmm.
It's either Panadol or not. Why? Because that statement can be true. That statement can be false. Because as a pharmacist, I would say, what does it contain? Paracetamol. What does any other one contain? Paracetamol. The same thing now. But someone will still defend it and tell you, no. I use 500 milligram active ingredient of paracetamol. Yes, you use the same thing. But my bulky agent is different from yours. Mine readily disintegrates in the stomach. Mine readily delivers the drug within 15 minutes. Mine readily penetrates into and gets absorbed. What about yours?
Yeah.
So for the fact that we all contain the same thing.
Yeah. Remember, I told you, people have trust for brands. Like I, for instance, I've tried some brands and it works. A very clear example is, and I'm going to mention name here. There's this drug we give children when they're teething.
Okay.
Yes. There's this foreign one, pecan. Yes. The moment you give a child pecan, I don't know. I have 2 boys, so pecan has been like a magic wand, right? And it just works. But when you bring the other ones, and I'm not mentioning their names.
Okay, but what works? The temperature?
Oh, the temperature comes down. The child is now, back to life. A child can be almost dying.
So now you can now let me just mention that you can now see, okay, when you now check, pecan as a brand contains paracetamol.
Yes, it does.
And then another ingredient called diphenhydramine. So, but what about it is made in a syrup?
Yes.
A syrup gives it a good taste. Now, how they make that syrup probably remains their secret.
It's like Coca-Cola, right? Yes.
That's their secret. That has a way of delivering what it carries.
Yes.
Because syrup is all about sugar. Nothing more. Sugar in water. There's a percentage of sugar in water. That's all. Wow. And then you now impute the paracetamol and the diphenhydramine. Now, they have a formula of which they made in such a way that probably it delivers the paracetamol into the system effortlessly. So much that it goes and does the work of bringing down the temperature. And then reduces the itchy, probably gums. The baby is having a discomfort. And your baby is back to life.
Absolutely.
Someone else can produce the same thing, but because the little technology is just like, the way the woman will like give woman A ingredients for egusi, give woman B ingredients for egusi, give them the same quantity, give them the same time, give them the same. But when you come to taste the 2 soups, you discover that, no, this is different from this. They all put in same quantity of whatever that was given. But someone will tell you, okay, no, I don't put my own seasoning until I am done.
Yeah.
Woman B will like, no. I fry my seasoning from the beginning. These things matter.
Yeah.
So these things can make one drug probably perform better than the other, notwithstanding. And amazingly, you may discover that there are some that it doesn't matter as long as you take it.
Yeah.
Like me, I was telling someone, I'm not so much of a brand person. And thank God I don't always fall sick, let me say like you. So, and I tell my kids, I say, if you are sick, I will treat you. To bring out teeth is not a disease. So it's better you just bring out your teeth quietly. But if you are sick, I will give you complete treatment. And the idea is that I'm not so much of a brand person, but I don't just give drugs anyhow. I don't pick up anything that is found, let me use that word, in the markets.
So you've been using example with paracetamol, and paracetamol is one of the most, if not the most abused.
One of the most abused drugs, yes.
Yes, apart from other antibiotics and all of that. We'll get into that shortly. What conditions will make someone to take paracetamol? Now that we're here on air, when should I take paracetamol?
Amazingly, people take drugs for different purposes. You cannot outrun this generation. If I can tell you, I may not be aware of the reasons maybe some people even take paracetamol. But ideally, as simple as paracetamol is, it shouldn't necessarily be taken without a prescription.
Without a prescription?
Yes.
Oh, wow.
You need a proper prescription to take paracetamol.
Paracetamol, Advil, ibuprofen, it requires doctor's prescription?
Call whatnot. Because these drugs have their issues, even though we may not be aware of it.
What are some of those issues?
Hepatitis.
What?
Yes.
Okay.
Hepatitis can be induced by a simple medication widely abused like paracetamol.
I thought it's a virus.
There is drug, or let me call it chemically induced hepatitis.
Wow.
By the way, what is hepatitis? Inflammation of the hepatitis. Hepatic is liver, just the inflammation of the liver. So what can make it inflame? Chemicals. What kind of chemicals? It can be drugs. What kind of drug? Paracetamol. Wow. So when it comes to the causation of drug-induced hepatitis, paracetamol is number one. And there are other drugs. So you now see that ibuprofen now becomes safer to someone that has hepatitis.
Wow.
But change the condition. I once in a while have some, heartburn, especially when I don't eat early, and then it is safer to go for paracetamol than to go for the ibuprofen you're talking about. So depending on the condition, because ibuprofen is more or less like an acid to someone that is already having an acidic related condition.
Wow. This is making sense, because I had a mortician here, someone that works in the morgue.
Okay.
And I asked him a question about what are the leading causes of death in Nigeria based on statistics of the corpse they receive.
Okay.
And he mentioned hepatitis as one of those.
Hepatitis can be drug induced.
Wow.
And I'm talking about the normal drug like paracetamol.
Wow.
But I can tell you one of the other leading cause of drug-induced hepatitis is herbal remedy.
Yes, herbal remedy. Is it inferior? Is it superior? Is it the same as the refined white man's medication that we take?
Difficult to answer. Difficult to say yes. Difficult to say no. Why? I'll go back to one of the first things I mentioned here. The neem.
The neem tree.
The neem tree.
Yeah.
From the neem tree.
So bitter.
You were a victim. Then some of us took it, yes. They will just boil the thing in water and then fill it in a very big cup and they will tell you, drink it. You'll be fine. And actually, you'll be fine. But what am I trying to say? Now, when you put that leaf into water and boil it over time, I don't know how our mothers got to know the timing.
Yeah.
What the boiling does, you are exposing the leaf to the water so that it pulls probably the content of the leaves.
Wow.
Now, science now came and told us there is something inside that leaf. Part of the content takes care of malaria parasites.
Oh, I see.
Part of the same content from the same leaf can take care of a heart disease.
Yeah.
and quite some other things. Let me just stop on these two. Now, if that neem tree is being boiled and you want to consider someone that has, let's say, malaria,
Yes.
it contains something like quinine inside. Now, what quantity of quinine does a cupful of that has? That will not affect someone that does not have a heart disease. Because you are giving him quinine and that content that affects the heart.
Wow. Wow.
I don't know if you're getting the gist.
Yes.
So in as much as a person has actually taken care of his malaria, you have exposed the heart to a chemical that he doesn't need.
Wow. You know, I've always had a
So
problem
someone will
with,
still tell you, sorry
Yeah.
to just cut you short, I took all these drugs from the hospital and I didn't get
Yes.
fine. But when I took this concoction,
Yeah.
I was fine. How do you argue with such a person that he has actually exposed his heart to treat
So
the
it's
malaria?
like robbing Peter to pay Paul.
Now let's come back to the hepatitis. The liver is one of the most important organs in
Yes.
the body. Now, I'm not downplaying
Other organs.
other organs.
Yeah.
Why am I saying this? Whatever goes into your mouth
It's processed better.
is processed, detoxified. Every single chemical is singled out by the liver.
Wow.
It singles them out one after the other. How many of such are in a cupful of that water? Now, if that liver has probably already been exposed, what happens to the person?
It's gone.
And now you come to discover that there are some herbal remedies that are said to treat hepatitis. Now, I can't talk without mentioning alcohol.
Yeah.
Alcoholic beverages, especially, let me call this beer. You know, there's a difference between beer and let's just say alcoholic beverages.
There's small money, big charge.
Every single chemical in that beer, be it local, foreign, or what have you, as long as it is beer, the liver detoxifies. It singles out every one of them. So the liver is truly exposed. And that will give you meaning to why we say, if you're not sure, why can't you just use water to take that drug? Because water is water.
Yeah.
The drug goes into the body, the liver handles whatever it will handle, and then the water washes it off. Try to take water in the morning. Yes, I will make sure that I take kunu. That's not water. No, I've taken 2 cups of tea. No, that's not water. Oh, it's just a simple tea bag that I put in. That's still not water. Oh, I didn't add sugar. You didn't take water. So if you just want to be safe with your medication, sometimes just go for the water. Eat and take water. Some people will tell me, no, I don't know how to eat without taking something soft. Well, the idea is that you're giving the liver some work to do. Just be aware.
Wow.
You may not necessarily have any form of hepatitis, but your liver is working. So that's why we can say chemical induced hepatitis.
Yeah.
Drugs can fall in there.
Mm.
Some chemicals, which can be inhalations, can fall in there. As simple as you painting this room, and then these are chemicals. You inhale them. Some of them can potentially go into the system and cause this. There are certain foods that you take because of the preserved, this especially these packaged, canned foods. Some of them will contain some chemicals that can end up. I mean, chemically induced is rampant. The one that is so popular, I have hepatitis A by virus A, hepatitis virus A, hepatitis B, which is caused by the hepatitis B virus, hepatitis C, which is caused by the hepatitis C virus. That's viral hepatitis. And there's bacterial hepatitis too.
Wow.
But let's say you have some few choices. When it comes to the viral, to what about the drug induced? What about the chemically induced generally? So these are the realities, of our time that we can't run away from.
So you're doing a PhD program in synthetic pharmacy.
Yeah, synthetic and medicinal chemistry, or synthetic chemistry, organic chemistry, but in synthetic organic chemistry.
What is it? What is synthetic chemistry?
I'm a very small boy when it comes to chemistry, to organic chemistry, to synthetic chemistry. Now, it's a part of chemistry that has to do with what we call synthesis. Now, in synthesis, you start with something you know,
okay,
in order to get something you're looking for. Now, in synthesis, you know that when you bring A and B together, it will give you neither A nor B. You end up with like C.
Yes, a combination.
That's
of
something
A and B.
new. A combination of two different things to give you a new thing. In fact, sometimes it can be a combination of one thing in a different way, and it will end up giving you something different. Whose activity will be different. What it does will be different. A, let's assume A is used for the treatment of malaria. And then I brought in a little component of C that we necessarily is not used for any treatment. And B, you now conjugate them together. You end up with C, probably you end up treating cancer.
Oh, I see.
So synthesis is a world that is explored, presently in chemistry.
So what role do you think it plays in the discovery of cancer medication?
No. It's a lot.
Okay.
A lot. Is it just cancer? Call any medication. Like, we are in the age of what we call computer-aided drug design.
Wow.
Fragment-based drug design. Now, that brings us to, virtual. So we are not just talking about virtual meetings. There's what we call virtual screening of drugs. Before I actually go into the lab, we call it, let's say, before you go into the wet lab, where you do practically, work on some chemicals, you go into the dry lab. You sit in your computer, like, in fact, if not for this, I should be working partly in my virtual screening now. You in synthetic chemistry, I can get a molecule I know. I know that this particular molecule with another different molecule. Now, based on what I know about the chemistry of these individual compounds or molecules, they contain certain things we call like active groups. We call them pharmacophores that will make it possible, for them to combine. Okay, it's just like you having a key that can open a door. There are certain keys that when you look at them, you say, no, this key cannot open this door. Why? Just because when you look at the configuration of the key,
Yes, it doesn't
and then you
match
look at
the whole.
the hole where it should enter, you say, no, it cannot. So that's the way in chemistry. There are molecules that when you look at them, because of the configuration of the molecule,
Yes.
you will know if it can combine with another molecule to give you something. Again, let's talk about the cancer that you mentioned. In synthetic chemistry, you can use computer-aided drug design to okay, what are we trying to treat? We are trying to take care of cancer that is found around the breast. Now, the target is the breast. What are the features of the breast? The breast is highly lipophilic. Now, drugs are lovers. Drugs are lovers. That's a statement I may need to make. Drugs are lovers. There are drugs that love oil.
Oh, I see.
Environment. There are drugs that love water environment. So when I say lipophilic, it means it loves a particular environment that can be water loving.
Okay.
Are you getting me?
Yeah.
So if it loves an oily environment, then I need to configure a drug that will be attracted by an oily environment. That is why you can have drugs that their concentration will be around an environment that is very oily.
Wow.
So lipophilic is water loving. Hydrophilic means something different. Are you getting me? Yeah. So based on the environment, we can now channel certain molecules. Now, if you show me a structure, that's some people don't like chemistry. Structure. If you show me a structure, I'll tell you, this drug is likely going to go through the kidney. Why? Because I can see some parts of the structure that has more to do with water environment.
Wow.
The kidney makes urine. So whatever that you take into the system before it leaves the body, it may have to go through the kidney. If it is not water loving, then it may be what we may go through. Let's say it will be excreted. It may be cleared maybe by the liver.
Okay.
Because it's a little bit of oily environment. Now, if I need a drug to go to the brain, to go and take care of something in the brain, then that drug should be made in such a way that it will go to an oily environment.
Yeah.
It must have affinity. It must love an oily environment. And I can mention the simplest drug I've been mentioning all this while. Paracetamol.
Wow.
That's pecan you mentioned earlier. Goes to the temperature center in the brain. That's why I told you that there is a formulation, there is a way probably they formulated in such a way that it can access the point whereby it needs to make the difference. Because if it goes to the brain, the center in the brain, and let's say it switches off what is increasing the temperature, of course you'll be fine.
Yeah.
It goes to where it has been an issue in the brain and it occupies the pain center where you're having a headache. You're fine. But if the pain actually is there in the head and the drug cannot access what it takes to stop the pain in the head, the drug is useless, even though you've taken multiple doses.
Wow.
So, synthetic chemistry can actually do a lot of design, even to the molecular level. Because the study of cancer has gone even to the molecular level. There is a particular molecule, just a particular touch on that molecule will make the whole difference. You can easily get that in synthetic chemistry. That can be done.
So when I hear the word synthetic as a lay person, all I hear is unnatural,
Very well.
inorganic.
Very well.
Can you throw more light on that? Is it safe? Is it not safe? You know what I mean, right?
Okay. You see, talking about natural or unnatural. Earlier, we mentioned some things that have to do with like a particular concoction from one tree with so much content. Yeah, I just mentioned 2. You are treating malaria, and it has another ingredient that has to do with the heart.
Yeah.
And so what I'm trying to say is this: whether natural or not, what makes a drug safe or unsafe is the interaction it has with the body.
Okay.
Now, when you make a drug synthetically, there's what you call precision. If the drug interacts straight and directly to what we call a receptor, because there's always a receptor that is connected to something. There's a receptor that chloroquine attaches itself to make you itch.
I see.
There is a receptor that chloroquine attaches itself to that kills the parasite that causes malaria. So you can now see that the chloroquine goes into the body, attaches itself to the parasite, deals with the parasite, but there's also another receptor that the chloroquine also interacts with that causes itching.
Wow.
What is the game changer? You discover that not everybody necessarily have that receptor.
Oh, wow.
That is why some people will take chloroquine and they don't itch. Others will take chloroquine and they itch.
Like me.
So what is wrong with the drug? Nothing.
So it's the
What is
individual
wrong with you?
difference.
Nothing.
Nothing. Okay.
But there's an interaction that your body has with the drug
Yes.
that makes you have what you have. Now we call that idiosyncrasy.
Idiosyncrasy, like in.
Now, idiosyncrasy is your body
Yes.
responding to a particular part of the drug you've taken.
Wow.
But I'll tell you again, in synthetic chemistry, right from the moment you begin to do the design,
Yes.
there's what you call medicinal alerts.
Okay.
Yeah, you're getting me excited. These medicinal alerts can be called as structural alerts. That means from the structure of the molecule of that drug,
Yeah.
there's an app that will tell you this part of the structure can cause what we call idiosyncratic reaction. What does that mean? It is possible that this part of the structure of this drug can enter into my body,
Yes.
and then my body has a potential ability to react with this part of the structure of the drug to cause a reaction. Now, we don't know what the reaction is, which can be itching,
Yeah.
which can be any other thing. I don't want to mention something. And then that's a medicinal alert. Now, when you get such alerts, you handle it at that level. The drug is not yet in the market. We are still planning.
Yeah.
There's what we call reactive metabolites. Still, we are talking about medicinal alert, which is twofold: structural alert or reactive metabolite. Now, what do you mean by metabolite? The drug goes into your body, your liver acts on it, it breaks it down into components, and then it begins to work in your system. Now, some drugs are called prodrugs. Prodrugs means as it is, it will not work. But when the liver breaks it down, it begins to work. Now, when the liver breaks it down, it's now called a metabolite. Now, right from the design of the drug, we are talking about safety or not safety.
Yeah.
To tell you the process, the vigorous process, designing of a drug goes through before it even comes to the market. That structural, that reactive metabolite alert gotten is handled at that stage. So that the web space will show you there's a potential that if this drug goes into the body, it will form certain metabolites. It will form something else apart from what you have taken that can possibly cause a reaction.
Wow.
You knock it off at that stage. That's at the stage of design, of which in my pursuit of this degree, I am even on. I can tell you I started with over 100 different molecules.
Wow.
At this stage, this 100, due to the medicinal alerts, that's the structural alerts, reactive metabolites, other factors, there are quite a number of things, other factors. I am presently just considering 4.
Over 100.
Over 100.
Nice.
Just 4.
Wow.
And there are still issues I'm yet to deal with.
How did you come down to 4?
I did so many things. Okay, now you're asking me to go deeper. What I'm trying to do is to ensure that a particular drug does not go defunct. When you keep using a particular drug, the bacteria is an antibiotic I'm actually working on, is a bacteria. The bacteria begins to get smart. Earlier we said somebody was treating typhoid,
Yes,
off the mic, we were discussing someone treating typhoid. She's using an antibiotic. Now, it's possible that antibiotic, you discover that, you'll be told that it is resistant. When she doesn't recover, okay, let's go and run a culture and sensitivity test, and then we discover that antibiotic she is taking actually is resistant. Has developed the bacteria has developed some resistance to it.
So what causes this resistance?
What may? Several factors. But the point I'm trying to make is that the bacteria on their own are getting smart. You are killing us every day, so we are just trying to be smart. Now that we know that this drug is coming. When it is coming, we'll behave like this. We'll pump the drug out of our body.
Wow.
Yes. So, due to overusage of drugs, underusage, poor adherence to prescriptions, you started treatment, you feel better, you just stop on the way, and then the bacteria are beginning to recognize that, okay, we are not totally dead. Okay, they now give birth to more resistant species.
Wow.
So when their children come on board, you expose them to the same drug that their parents took, they are now
Doesn't work.
smarter than their parents. So that drug may end up not being effective anymore. So I'm picking one of these drugs. I don't want to mention that particular one on air. Picking one of these drugs and then bringing a particular fragment of a drug or of a chemical to incorporate it into this drug.
Yeah.
What do I want it to do? Now, this drug is known by targeting a particular enzyme in a bacteria. Once you stop that enzyme, the bacteria will die. Now the drug is beginning to find resistance. It means that the drug is either not able to stop the enzyme, or the bacteria are beginning to what? The microorganisms are beginning to play smart. So I said, okay, are there other enzymes in the bacteria? Yes. Are there drugs in that regard presently as I'm talking to you? No. So, by the use of computer-aided drug design, we now screen some molecules against those targets. You remember I mentioned targets earlier?
Yeah.
I screen the molecule against those particular targets and discover that, virtually, they can inhibit those targets. So, if the drug already available in the market can inhibit target A in the bacteria, in the microorganism, and then this molecule I'm trying to bring into this drug can inhibit target B. Potentially, it means that I'm trying to make a double barrel. And giving that drug a double barrel. So that when you swallow a pill, it will go in, inhibit A, you're trying to outsmart it, it will not inhibit B.
Yeah. Sounds like an action film.
Killing you twice. I give you the first bullet, you refuse to die, I drop the second bullet.
Okay.
So double damage to the bacteria potentially should be able to keep that drug in the market, and we take our drugs within stipulated time frame and get well.
Wow.
So how is it helping? Discoveries. In fact, I'm beginning to find out so much about some of these drugs because I discovered that there are quite a number of drugs that are active against certain bacteria that they are being used for something else.
Yeah.
I'll use something very, very quickly. Something very, very easy. You know, there's this medication that we sometimes use in killing rats.
Oh, yes.
Can you remember the name?
I know it's controversial, but I know
That's medication.
The one people are using for suicide and stuff.
Okay, not necessarily for suicide, for just killing rats.
Okay.
No, there's a tablet, there's a painkiller. In fact, no, let's mention it. Indomethacin.
Okay.
They call it Indoseed.
Yes.
You give rats Indoseed, they eat and die.
Yes.
But a human being takes it and his pain goes.
Okay, it doesn't kill a human being.
No, it's a painkiller.
Okay.
It's a painkiller. Now, there's a fragment of that painkiller that is antibacterial. That is antibiotic. Yes. These are the discoveries I'm beginning to make.
How does it kill a rat?
Because a rat is a rat. It's not a human being. But if a human being takes it, it heals your pain.
Yeah.
It heals your pain.
And
the system of a rat is different from that of a human being.
And rats are
so it's very, very, very possible that, you know, I didn't study that, but I'm just saying it's very possible that when a rat should take the so-called painkiller, it probably destroys the liver.
Oh, I see.
I'm just talking about the rats. I'm just making assertions. I don't know how it kills the rat, but I'm just trying to say that is possible.
Yeah.
But for the human being, it is 100% safe as a painkiller.
Yeah. Wow. So, talking about market, you mentioned market earlier. Why do you think some drugs, although people are depending on them to save their lives, but they are so inaccessible, so expensive? What are some of those things you think? Because there's this skepticism about big pharma, right? And people have this notion that the big pharma is just trying to make money, like you said, big business.
Yeah, it's a multi-dollar
like
business.
Like in countries like the US and stuff, big pharma is something they talk about a lot. Why are these drugs very expensive, like cancer medication, for instance?
I will still give this. I'll answer it this way: that can you imagine that For the past, I started this PhD program 2017.
2017. Okay.
What year is this?
It's 2025.
There is no single grant given by the government to fund this research.
So you have to just look for how to do it.
So imagine I not getting support from the local environment, from Nigeria. And the so-called big pharma sponsors the research. Who gets the findings?
Oh, wow. The big pharma.
Who gets the secrets?
The big pharma.
Who keeps the secrets?
The big pharma.
Why should they give you for free?
Wow.
Do you know how much it takes on the average to work on one single drug? Over 10 million USD.
One drug.
One.
To develop it to standard.
Yeah.
Wow. That's
research.
It
may take, if you're not careful, not less than 10 years.
Wow, to develop a drug.
To get a drug from research to the market.
Wow.
Now, we are not saying cough out 10 million USD.
Yeah.
But we are saying, can you at least support this research and see it to some extent, to some conclusion? Can we have some secrets that we have sponsored ourselves?
Wow.
Yes, the big pharma have the money, but how ready are we to support our own? Why should they give you for free? They spent billions to get it. They have some patency rights. Even if the answer is behind your house, but you don't know. Someone paid to know that is where the answer. You know, sometimes I don't argue much with the mechanics. Your car just stopped. And you call the mechanic, he tells you, let me just call my electrician. The electrician, I think will do better with this. And the electrician came around and you're frustrated. And you say, Oga, you pay me 10,000 naira. He said, you've not done anything here. No, I know the problem. And I can fix it.
Yeah.
Now, the problem may just be a single wire cut. But because you don't know, you are paying him because he knows. Not because he's going to dig a borehole with his bare hands for you.
Yeah.
And by the time you pay him, he may just fix the wire within a second. Now, don't be angry you lost 10,000 naira. By the way, with the 10,000 in your pocket, your car didn't move.
Yeah.
So, are we saying that we are paying the big pharma because they know the answer?
So, there's something I heard, and this is not related to the cost of producing drug per se, but the ethics. I had a conversation with someone who studied pharmacognosis. Kind of. So he was talking about a research he did, and he discovered, let's take malaria for instance. He said he did a case study on malaria, and he discovered that a lot of modern malaria medication, the efficacy of the drugs were reduced.
Okay.
So you see a situation where someone who's treating malaria may not last up to 3 months, and then he's down again with malaria. So kind of he's ascertaining it to a pattern of, I buy the medication today, I take it, and then tomorrow I have to come back and buy again. So you see, there's a way like the big pharma is still accruing money as a result of the efficacy of the drug being reduced, as compared to then when we used chloroquine, and then it takes a while before you come down with malaria.
You know, as you're talking, I'm trying to be reasonable.
Yeah.
Let me ask you. Okay, when last did you take any medication?
New medication. It's been a while. Last year, I don't know.
Okay.
Mm-hmm.
How long do you wish that paracetamol lasts in your body?
Oh, forever.
Okay. How long will you wish chloroquine lasts in your body?
At least a year.
Okay. But why does the itching go?
I don't know. Maybe it's done. It's
Because it needs to be cleared out of the system.
Okay. So that. Oh, wow.
So if every drug you take
Mm-hmm.
stays in your body for a year, what do you think will happen? To someone that is hypertensive, diabetic,
Mm-hmm.
and probably has hepatitis.
Wow.
And you know, hypertension, you may end up taking 3, 4, 5, 6 different medication. Diabetes, you may end up taking 2, 3, 4, 5 different pills. Hepatitis, I don't know if you're getting my point.
Yeah,
Now,
I get
this
it.
person is taking like, let's just sum it up. Let's just assume this is taking like 6 different pills every day. Because these are diseases that you manage. They are chronic. You manage probably for a lifetime. And then each medication is to last for a year in the body.
Whoa.
Does that bring you to reality?
Oh, yeah.
That it is almost not possible to have a drug stay in your body to keep fighting the same thing. That's the idea.
So prevention.
So if the pharmacognosist,
Yes.
that's one of the courses studied in pharmacy.
Mm-hmm.
It's just one out of plenty. Will say, if I should take medication for malaria, I think last year I treated malaria once, that medication should remain in my body. It simply means that that medication should also, the side effect should also remain in my body. It should not be cleared. It should bioaccumulate. I have another disease, probably I end up having surgery, and then I was injected with an anesthesia. That anesthesia should stay for a year again in my body. It means I shouldn't wake up. Are you getting the point?
Yeah, I'm getting it.
Because the drug should still be working. Nothing should take it off the system. So, but we are trying to say that the liver breaks this drug down, takes it off the system. You may excrete, you may sweat, you may urinate these drugs off. You've taken malaria medication, it has taken care of your malaria problem. 1, 2, 3 days, you are good to go. What should be responsible, except if the drug doesn't work? If it fails, that's recrudescence. It's a different thing. But if it worked, it is either it works
Oh, it does.
or it doesn't work.
There is no middle line.
There is no issue of it working,
Yeah.
and then it should continue to work even when the mosquito should bite you again, the one you have taken before. No.
Wow.
I don't understand science that way. Why do you need to take medication like ampicillin cloxacillin, Ampiclox, every 6 hours? Because it is known that by the time you take it, the drug, the concentration of the drug keeps building in your bloodstream.
Yeah.
It is now available in your body, it keeps going up. After 6 hours, it is expected that the concentration begins to drop. It is being cleared. And for as many that have taken that drug called Ampiclox, they will realize that by the time you take it, in the next few hours you're going to urinate, you perceive it in your urine.
Wow.
The same thing you smelled when you are swallowing, you begin to. So it tells you that it is being cleared from your system. It's not supposed to remain there. So that the next time you're having the same infection that Ampiclox should take 6 months after, the one you took 6 months ago,
Yeah.
she will still treat the infection. Nah. So it means that you keep urinating that same perfumed urine for 6 months.
Yeah.
I don't know if it's making
Yeah,
some sense.
I get it.
So all we're trying to say is that no, the drug should get into the system, get the job done.
And then you leave. Yeah. So I guess it could be a result of an underdosage, like
So if now that takes me to probably what he may be trying to say. When you are having a substandard medication, just the way I tried to tell you this, some people may go to countries, I'm not accusing them, sorry to say that, maybe, we rarely have the machineries here, but India, China may have the machinery. So you go to China, you go to India, and then you tell a particular pharma industry that I want to start selling paracetamol in Nigeria. Now, what's the acceptable range? There's usually a range. You'll be given, maybe you'll be told 490 milligram to 530 milligram. Maybe research may have shown that if you take 490 milligram, or you take 500 milligram, or 520 milligram, or 530 milligram, you get the same result. The side effect on the liver, remember I said it is hepatotoxic.
Yeah.
The side effect on the liver is negligible within that dosage range. But this person goes to the pharma industry and then said, I want to produce paracetamol, of which you will write 500 milligram. But I want you to put 300 milligram.
To save cost.
And to maximize
profit.
You will take the same drug, your headache will remain there.
Wow.
Because it is 300 milligram that is there.
Not 500.
While it is supposed to be 500 milligram. And even the 500 milligram, you take 2 tablets for adults. That's 1,000 milligram. So by the time you're taking 2 tablets of that particular one produced by that so-called pharma industry, you're taking in total 600. How can the headache go? Is it making sense?
Yes.
How can the malaria go? There are malaria medication that you see written 80/480. That is supposed to be the dosage contained per tablet. But if the pharma industry produced, let's say, 50/300,
yes, it doesn't do the job.
You can get okay.
Wow.
So you may feel like, okay, something is about to happen. It's like I'm feeling better, but no, I'm still sick due to a substandard medication. But if it works and it goes, you don't blame the drug for having malaria again. You may likely to have been bitten by a mosquito.
Wow.
Not that we are taking a drug that leaves the body faster than... No, now, in the first stage, in the first instance, it's supposed to leave the body. It is actually supposed to leave.
Maybe I didn't quite understand him very well.
So I want to assume maybe that's what he's trying to communicate across. So there's so much compromise probably going on. Just, I mentioned quite a number of things, even from the formulation of the medication. If the binder being used is not the correct, is the vehicle being used is not the correct, if the suspending agent being used is not the correct one or the appropriate one, I forget, like when you look at that medication you give your baby, you talked about that foreign medication. What I mean by a suspending agent, there are paracetamol is inside the syrup. I told you syrup is just water and sugar, a particular percentage of sugar in water. That's the syrup. Now the paracetamol is being put in there. Now there's something you call suspending agent, in so much that whenever you pour that syrup into a cup, let's say 5 mils,
yes,
it is expected that you have accurately a particular dosage of paracetamol in there. When you pick a bottle of paracetamol syrup, it is expected that every 5 mils should contain 125 milligram of paracetamol. They may have done something to ensure that. And that is why sometimes when you are getting a medication in suspension form, like most of these antacids, for stomach disturbances, also what have you, you'll be told to what? Shake vigorously. Why? So that it will evenly distribute the active ingredient around the suspension. And you can estimate a concentration of a particular active ingredient at every dosage that you take. So a lot comes into play when it has to do with the efficacy of a drug.
So, what's your take on generic drugs versus branded drugs?
The simple thing I can mention here is that, the branded drugs, they have a name to protect.
Okay.
There's a name.
Yeah.
Shamaki, you can grow to a stage that to a level that there are certain interviews you may not even grant.
Yes, and there's
because of
productions.
There are certain productions you will not do because you can't dent your name.
Yeah.
You've grown to a height that you must keep to standard. Same with these branded drugs. They have a name. So if anything goes wrong, they fall. But the generics, sometimes it can be garbage in, garbage out. It can. I'm using the word it can. But I can tell you again, because the branded drugs have a name. So the business people have their eyes on it. There is high chances of getting the fake.
Wow.
Just because of the name.
Yes.
So some people can produce anything and put the name. And because someone like Shamaki is so down with brands, you pick it up and it doesn't work. Now, is it the drug? No. You're just a victim.
Wow. I've heard cases of people who were on a medical outreach and they bought anesthesia, not knowing that it was just water.
You can see what I'm talking about.
Yes.
We have been using a particular injection, I don't want to call the name, as an adjunct in surgery. And we discovered that you give it to the woman you are trying to run a cesarean section on. Within 2 minutes, she's in pains again.
2 minutes.
And you begin to wonder what's happening.
Wow.
Substandard. You now go for a brand and the woman is good to go.
Wow. So there is a controversy where people say that pharmaceutical industries delay the release of medication because they profit with long-term treatment. Could that be true?
Okay, come again. Let me get the question clearly.
They have the answers, but they delay the release of the medication into the market, or they have a way of ensuring that your treatment is prolonged. You know what
Okay,
I mean?
I can't say no to that.
Okay.
I can't say no to that because people have their interest.
Yeah.
People have their interests. For example, malaria.
Okay.
Can there be a vaccine?
I thought they found a vaccine.
The answer is yes. The answer is no.
Why yes?
If the answer is yes, who is ready for the vaccine? Africa.
Africa, yes.
Where is the market for the malaria drugs?
Africa.
Africa. So if I am a big pharma and I'm making billions from giving you malaria drugs, and You are not interested in finding a lasting solution to malaria. I am making money. You still came back to me, or you still come back to me to eradicate malaria with a vaccine. What do you think?
I'm taking your business by the jugular. Wow.
So even if I'm going to give you an answer, are you sure I'll solve it?
You solve it partially.
So if you allow me, just by logic, this may be what is responsible. But if Africa has an issue, Africa stands to solve the issue for the sake of Africa, for the interest of Africa, I think we will get there.
Yeah.
Yes. Synthetic chemistry can do it. And that's one of the shortest way to get what you want. When COVID-19 came, can we wait for all the plants to be checked, to be isolated, to begin to know the dosage, to know some of the interactions? There's something we call docking. A docking study being carried. I have to carry such. You dock, you present the drug virtually to the site of action to see if it will work. Virtually.
Okay.
There's what you call the binding affinity. I told you drugs are lovers. They can love something oily. They can love something. So they can love a particular pocket better than another pocket. They can do better here. They can do, worse. So there's a competition actually going on in there. So you dock. So let's say we get. I did that in my house. When there was lockdown, I was busy checking, and I designed several molecules because chloroquine was said to work.
Yes, hydroxychloroquine. Yeah.
Hydroxychloroquine was also said to work. So I now designed other molecules. There's a way we do it from chloroquine and from hydroxychloroquine. And then I did a docking study on it. And I discovered that it can even do better than chloroquine.
Wow.
On that COVID-19 virus.
Wow.
Yes.
Wow.
But that's where I did the publication. Is there online? Will I go into the library, into the lab, the wet lab, to go and do it? Where's the money? Who's going to sponsor it?
So what you're saying is that our local scientists, local pharmacists can design this, but then
yes,
funding for you.
The solution for this is here.
Even the malaria.
Even the malaria. One of my senior colleagues designed something that should do better than the artemether lumefantrine we are taking for malaria.
Wow.
Potentially.
And how sure are you that it can do better?
So far, the results are showing it to do better.
Okay.
It will do better. But before it gets to the market, it needs sponsorship, it needs money, it needs some grants.
Have we ever, as a nation, sponsored the production of any medication?
I wouldn't say no, because I'm still a small boy in this.
But from what you know so far,
sponsor from start to finish, I'm not aware of any yet.
Wow.
We have the TED fund that will keep, in fact, I wouldn't want to go into the politics of all this because...
So how much do you think it will cost us to fund like malaria vaccination, for instance, the research?
I'm not sure I can give a figure, but it can be a whole lot.
Okay.
But the issue, if it takes beyond just the money. Okay. What about the facilities?
Okay, so
before NAFDAC became what we know, before now nobody knows anything like NAFDAC. The first thing I think the government as at then tried to do was, one, get someone that is purposeful and focused.
Yeah, the late Dora Akunyili.
Very well. And then get some equipment down.
Wow.
Like, just as I'm talking to you, I'm trying to get into the lab. Now I started going into the lab. Now I went back virtually. As I'm going into the lab, I'm supposed to monitor this A and this B. Am I forming the C yet or not? Just to monitor, to check as at when C will be formed. We don't have the equipment. I may have to send it to France.
So that's the
And one of my
closest.
colleagues is sending to get something reasonable. One of my friends is sending just to ship one. She spends not less than 250,000 naira
Okay.
from her pockets.
Is it that these machines cannot be sold, or we don't?
They are
just
not
want to buy
available.
for sale, or for,
I can tell you, not in Unijos. Let me
Okay.
speak for University of Jos.
Okay.
And if they were available, let's say in Zaria, probably I would have gone to Zaria.
Oh yes, they're not.
If it
very-
was available in University in Abuja, probably I would have gone to Abuja to go and do it.
Lagos, all those places too.
I wish.
Wow.
Why should I spend 250,000 naira to just send it to
And
France?
these are equipment that can be bought.
Yes.
Okay.
We hear only now in Nigeria that one person is stealing as huge as 200 billion.
Yeah.
And I'm not sure this machine costs
No, it
200
can
billion.
be. Yeah.
So are we focused and purposeful in achieving something substantial? I'm sorry to say, if the budget for lawmakers is far beyond the budget for the entire educational sector,
Yeah.
are we ready? Now we are just talking about research, which is a sub of the educational sector.
Yes.
I'm not sure we are ready. No, I'm not sure.
Oof. Wow.
So as I'm talking to you now, partly the delay is funding, unavailability of funds, and then the unavailability of equipment. They're not there. I heard somewhere, please don't ask me where, that equipment were brought without codes. It's just like saying, I gave you a very nice car without a key.
Oh wow.
And you're telling everybody, I got a nice car. The person that has keke napep is better than you.
Yes.
Because he can drive himself back home. Drive your own. So those machines are useless.
Yeah. So let's address an elephant in the room. You mentioned COVID-19 earlier. COVID-19 came with a lot of skepticism and misgiving. And I always say, if COVID-19 was as lethal as Ebola, no conspiracy theorists will have the mind, to insult science and all of that. There is a lot of theories regarding the COVID-19 vaccine, social distancing, all of that. There are religious bodies that came out to say the government wanted us to do social distancing because there was some things related to the Antichrist and whatever. There are people who came with herbal remedies for COVID-19. There are people who said that they're trying to give these vaccines to shorten the lifespan of people. In fact, some people gave specific time frame that if you take the vaccine, you have 3 years tops to live.
Okay.
Right? And some are attributing some people's death to the vaccine. Some are saying that the vaccine has cut short the life expectancy of certain people, right? Some have blamed certain billionaires of funding this. And I think one of the biggest victim is Bill Gates. Right. All of these things are, you mentioned something as to time. So COVID-19 vaccine didn't follow the normal protocol, didn't follow the normal time and the clinical trials required for it to be approved. But it was approved. And some people say it was 95% successful. Some people say it was more than that successful. Some say it's all a lie, it's a hoax. What can you say? Because you mentioned something about time. Do we have the time to wait and all of that? I feel like this issue is huge because it's coming back now. Because it's like there are certain researches that came out to say COVID-19. I think the drama around it was not necessary and all of that.
When some of us are not so much into the politics of socio-economic uh, dramas, let me call it that way, and the big pharma nations. COVID-19 in general, at a point, it became like a pandemic. And talking about time, vaccine approval, and hereafter. Now, there are times, let's say in life. Let me give a scenario. I was once called to calm an agitated patient that was into drugs.
Okay.
He left home for about a week with the house car, only for them to sight him in the streets with a car key, but without the car. That's after a week.
Wow.
So I was called upon. I was like, okay, the best we can do is to probably knock him off. I know drugs we can probably combine just to make him sober and then get him back home. So immediately he sighted me. It's like he now sighted me holding something. He now said, anybody that comes close, he will surely go physical. And of course, someone under the influence of drugs, no matter how strong you are, he is going to fight, maybe to kill. Of course, I can't fight him to kill him. So this approach will actually leave me hot. And then they're like, okay, let's call mommy. Oh, let's call this uncle. I said, no. Critical moments will demand immediate decision.
Wow.
You don't have time.
Wow.
You must decide here and now that we can see him. If you lose him, then get yourself to be blamed. Because he was actually walking away while trying to call. He may just, and I don't have all the time to be following him because I was actually on duty. So they were like, okay, what do we do? I said, okay, fine. Try to get him into a position and then I can inject him and then he'll go down. But fortunately, he walked into a beer parlor. And I was like, okay, that makes it easy. The injectable can also be taken orally. Give it to the barman.
Wow.
Let him take whatever. You can't stop him from taking whatever he wants to take. And then infuse that into his drink. He slept on the chair, to cut the long story short. COVID-19 was around, killing. Whether it is the COVID-19 or something else, but people were dying as a result of something. So, if there can be any solution, just the way I said, I sat in my room and I was trying to check what can actually solve this problem. Okay, if chloroquine can solve it, can something better than chloroquine, because people are still using chloroquine, can something better than chloroquine solve it once and for all? And I got some answers. Let's say there was a lab, there was a way we can actually bring this to reality and then check it. Of course, we may seek for the approval if 1,000 people are to die and then it may end up saving 100. Why not? It was a critical moment. It was an emergency. And I think the laws guiding such permits at such moments with some certain percentage of success, you can give approval. Nothing is 100% safe.
Wow.
But should we wait until we get something that can be as safe as water before we administer? I'm sure the answer is no.
A lot of water is not even safe.
Because even the water, you need to know the particular quantity you may need to take in order for you to keep up.
Yeah.
Like, there is a way you can be advised to take water in accordance to your weight. Yeah, 0.03, I think, per kg. Meals per kg.
Okay.
If you multiply that, that should be the minimum amount of water you should take in 24 hours.
0.03
mils
mils per kg.
per kg.
So if I'm 50 kg,
multiplied by 0.03.
okay, wow,
It will give you an estimate. That's the least you
that's
should
a
take.
good formula.
That's the least you should take.
You can
Because
take it all
otherwise,
at once, or you can space it.
no, within 24. That's what I'm saying. Within
Within
24 hours.
Okay.
So if after 24 hours you checked, you're like, I've not taken up to this quantity. It means you may likely be taking less. So I think what the world did then
Yeah.
was to do what they can do to save those they can save while work continues. But as usual, it was an opportunity for the pharma industries to do something, and they did what they could do. What about Africa?
Yes, I asked that question because we were the ones that were most criticizing of the vaccine.
But because coming to discover that some of the medication that were active against the virus are things we take like food. Was there any child or any adult, let me use that word, is there any adult born in the 80s? Oh, let me just say, is there any adult born in the 90s downwards? Because the kids now, I'm sure some of them don't even know what is called chloroquine.
Yes, they don't.
So if chloroquine works against it, then already it is part of our blood.
Yes.
So it may not necessarily. And I think that was one of the reasons why it did little or no harm to Africans.
Okay.
Our resilience, our genetic makeup also made up as a reason. You know, at some point, I think when I was researching on my undergraduate, I worked on HIV. When I was researching on HIV virus, I discovered that there are certain people that they don't even get infected with the virus.
Really?
Yes. There are.
In
fact, there are
Africa?
people
In Africa?
living, we call them seronegative individuals.
Okay.
Let's say the wife has HIV virus, but the husband never contracted it. And they've been together for years. And they're still together.
Wow.
Same with hepatitis virus too. So what is in this system? Left for research to find out. So I think the COVID-19 thing came. I don't know which one is true, which one is a lie. We keep reading and checking and knowing. But I wish Africa goes ahead to check. You know, coronavirus is nothing new. No, it's not a new virus.
Yes.
It's not a new virus. Somebody said, go and check one of the disinfectants. You see them writing, it is active even against coronavirus. Probably I'll mention it.
So, yeah, it's called COVID-19. That means there have been other
there are
variants.
quite a number of other coronaviruses.
Yeah. So why is it difficult to find a cure for HIV? As a pharmacist, what exactly is it about HIV that the cure cannot be found?
I'm not saying,
because I heard some people say they found a cure to HIV here in Nigeria.
Yeah,
but then they said they were shut down by the government.
These are still stories we keep hearing here and there.
Okay.
I don't believe that, as someone that believes in God, that God will give us something without any solution. I believe so much in that. And in fact, the solution can actually be in nature.
Okay.
The solution can be in our head, wisdom. Because it's the understanding you have of what is going around that you tend towards the solution. The virus is smart. The virus does what we call, it mutates.
Wow.
Consistently.
Wow.
What am I trying to say? If it gets into my system, there is a way it behaves that is only specific, peculiar with me. So are you going to make vaccine for over 6 billion people? So that if it's with Naruka, the vaccine is for me. If it's with Miss B, the vaccine is for Miss B.
Wow.
I think that's the idea. Unlike something like Ebola, that has a particular way it operates. And immediately the world understood the way it operates. It shuts it down.
Wow.
It has a particular way it operates. And then once you break that communication, that's all. For the HIV, it's difficult. There are several ways to make drugs for ailments,
Yeah.
for management. Like HIV has quite a number of enzymes here and there, and then drugs are being made to tackle maybe each of the enzymes here. Now this is just for treatment. The reverse transcriptase, the protease, the integrase, the maturity inhibitors. But to get like a vaccine that will halt everything is proving difficult. But I'm sure we'll get through this.
Wow.
I'm sure we'll get through this. Wow. Why am I so sure? It's not an African problem only.
So, okay. Yeah, I get your point. Yeah. I read a book by Everett C. Koop. He's late now. He was the Surgeon General of the United States, I think under the Reagan administration. I'm not so sure.
Okay.
He wrote a book called Memoirs of American Family Doctor. He asserted that as Surgeon General, it was during his time that HIV broke out.
Okay.
And it was within his obligations and responsibility of office to enlighten the American public about the safety, the health, the health safety, because Surgeon General in America is like a doctor of all the doctors.
He's overall.
Yes. So he said in the book blatantly that he was threatened, especially by the church community, even with the revocation of his license, losing his job, if he ever said anything about HIV. And they said this was a virus brought by God to wipe out homosexuals, because I think the first incident was within a homosexual community. And according to him, it was easy to contain it because you could just map out the community and then make sure it doesn't come out of that. And that was not controlled because the people who were threatening him felt like it was an opportunity for the homosexuals to be wiped out, right? And now, fast forward to modern times, HIV was not only a homosexual disease, but killed more heterosexuals than homosexuals.
Yeah.
In fact, I read a book where I think it was in Uganda, where the cases of HIV was so much that the government had to put street lights in the burial grounds to enable burials at night.
Wow.
Because of the high mortality.
Yeah.
Right. We have certain assertions. So, for instance, some people claim that HIV was engineered in a lab. Some people said that hepatitis virus were engineered in the lab. Have you heard something like that? As a pharmacist, can you confirm that there are certain viruses that are killing people today that were engineered in the lab? Some people even said COVID-19 was engineered in the lab.
Yeah. We keep hearing stories like that. And genetics is what comes into play. And the world of genetics is a world of possibilities.
Wow.
It's in the world of genetics, molecular biology, that will give us an opportunity to go and clone another Naruka. All they need is just a drop of my cell.
That's it.
And another Naruka will be cloned. So if cloning is possible, do you think making a virus is impossible?
No.
We are having dogs as hybrids today.
Yes.
Not purely
Yes.
this nor that, but a hybrid that will probably not behave this way, nor this way. Is that possible?
Yeah.
Yes. Certain characteristics can be enhanced with genetics. And certain characteristics can be eliminated with genetics.
Amazing.
I can make a bacteria more virulent, more aggressive in molecular biology. Yes. So, in doing this, this is my intention. But in reality, what comes out, I myself may not be even sure. Be sure. I know what I'm trying to do. I know what I'm trying to eliminate. I know what I'm trying to enhance. But when that thing comes up, am I sure?
Wow. Sounds like dark science.
That's molecular biology. Now, we are getting into treatment in medicine such that if I'm treating Naruka for hypertension, it should be individualized
Wow.
for Naruka
Customized.
based on my molecular makeup. So that the chloroquine that will come to me should be in such a way that it will not interact with that surface that causes itching because it itches me. Individualized medicine.
Wow.
So I've answered your question.
Wow.
These stories are not far from the truth.
Wow. So, sir, as a pharmacist, who is an academician and also
In the community.
in the community, you've dispensed quite a number of drugs to people. I have seen cases where somebody has like 13 drugs to swallow.
Okay.
They prescribe this,
13.
this, 10 to 13 to swallow at once. Is that safe practice?
Polypharmacy.
Polypharmacy.
We as much as possible discourage that.
Okay.
My eye is paining me doesn't mean I should give you an eye drop. My head is paining me doesn't mean I should give you paracetamol for headache. My stomach is paining me doesn't mean you need flagyl for stomach. My leg is paining me, okay, another painkiller for leg. Do you get? No. No. Polypharmacy is highly discouraged because, as I said, drug are lovers. You take something lipophilic, okay, maybe I didn't break it down, lipid, oil. It loves oil. Hydrophilic,
loves water.
It loves water. So some goes to the oily part of your body, the brain, the breast. If you are pregnant, there's the BBB, blood-brain barrier, the placenta, oily, your liver, hydrophil, it loves water, your kidney. Yeah. So you're just taking concoctions. In fact, there's what we call interaction again. One drug can interact with another drug to make the other drug either to not work or to get eliminated or to become redundant.
Wow.
There's a way you combine two different drugs. At the end of the day, the drug will stop one other drug from working. Let me take some drugs. I don't want to mention it. Let me take some drugs that we call like hydrogen pump inhibitors. They are used for ulcer treatment.
Okay.
You take it first, and then you now took your anti-diabetic. It's not going to work. As it is helping you with the ulcer, pain, moderating the acidity in the stomach, it is not allowing your anti-diabetic medication to work.
Wow.
Because you are trying to handle the two at once. So if it must be taken, probably, okay, can you take this medication an hour before meal, like your hydrogen pump inhibitors? And then an hour before meal, it will work perfectly. And then when you finish eating, take your anti-diabetic medication.
Okay, not to combine them at once.
Not to combine them at once. So taking 10 to 12. In fact, there are quite a number of people that come to me with such prescription. One of the ways it helps, there are some drugs that can come 2 in 1, like some anti-diabetic drugs. you may find 2 different drugs on one pill. That reduces your burden from 2 to 1. And then some that may be duplicated. I've seen prescriptions like that. They duplicate a lot. You see someone being given 2 to 3 different antibiotics, trying to target 2 to 3 different disease conditions. And I said, no. When you give a broad spectrum, since you're having a respiratory tract infection, there are certain antibiotics that can do well as respiratory tract infection drugs, still take care of your salmonella infestation, your typhoid, and it will still take care of the injury that you have on your hand. Just one.
Wow.
Instead of giving 3 different ones. So you can now see 3 being narrowed to 1.
Yeah.
And are you sure you're having malaria? Did you run a test? No. The doctor just assumed. You can knock that off. Your blood pressure was not that high. Why were you giving antihypertensives? 2 or 3 different types. You may monitor the blood pressure based on the level and then advise appropriately. So some of these pills may not necessarily be advisable. If it passes through the pharmacist, and I mean the pharmacist, he should be able to help you out.
Wow.
And that is why it is good to discuss with your doctor. And then the pharmacist should come in. You can't at any point rule out how important the pharmacist can be. Rule out one of the collaborators in the healthcare system. The patient is exposed to more risk. Yes, the pharmacist has idea about what the lab is doing. The laboratory scientist is doing. He has so much idea what the doctor is doing. Now that we are into the PharmD, more of the clinicals added to the pharmacy study. We have ideas of what they are doing. The doctors do pharmacology for, I think, a semester or 2. So they have an idea of what's just pharmacology. There are over 10 departments in pharmacy. So the pharmacist is more equipped when it comes to the drugs. All the lifestyle of the medical doctor is to diagnose. So he's more equipped to diagnose. All the lab scientist is made to know is to run investigations in the lab. So he's more equipped.
Yeah.
But none of these ones is ignorant of what is sometimes happening in these different fields. Are we there?
Yeah.
So it doesn't mean that one should be ruled out, because at the end of the day, we all collaborate to ensure that the patient gets the best.
Yeah. So, what do you think about lifestyle medication?
Lifestyle modification when it comes to treatment?
No, like medication people take to boost their muscles, to change their hair, to look good, with supplements and all of that. It's becoming rather more rampant. You see even younger people now on certain supplements.
Some of these, or should I say most of these. Yesterday, a lady approached me that, hey, pharmacist, I want to get a little bit chubby. I just want to get a little bit chubby. Just give me something that will make me feel, I wasn't like this before I got married. And I say, how are you now? You think you are better? Or you think you are worse? You've got 2 babies, but you want to look like yesterday. And I just told her the first thing. I said, to the detriment of some of your organs in the body. Your kidney, your heart, your liver. Because some of these medications have a lot of steroid, especially those that are trying to build huge muscles. So much steroid to stimulate, the muscles, to build the muscles at all costs. So much training, so much restriction to certain diets. I feel it's not worth it.
Wow.
especially the heart. A lot of people take some steroid commonly found in pharmacy just to add up some weight. It weakens the heart.
Wow.
I told the lady yesterday, I said, your heart is at risk. Do you want to look good outwardly, but be dying inside? Or do you want to be healthy in and out? She said she wants to be fine in and out. Then I said, "Then let's go slowly." Right from our primary school, what do we know? Proteins are body building foods.
Yeah.
Eat more of the proteins. When you go deeper, eat more of the healthy proteins. When you go deeper again, based on your age, you may be asked to restrict some amount of protein
Yeah.
so that you don't walk yourself into another disease. Carbohydrates are what? Energy giving. So do you want to build the body without energy? No. Energy giving food. The fats and oil. We discovered that, okay, with this age and time, a lot of oily foods are available. In fact, oily food are sweeter.
Yes.
They're sweeter. You know, the fried meat
The
tends to
fats.
be sweeter than the cooked
Yeah.
meat.
Yeah.
But these, in the long run, clogs some of the blood vessels, exposing you to more dangers.
Yeah.
The blood vessels begin to get narrowed. The pressure of the heart begins to increase because it has to pump blood through the narrowed blood vessels. You begin to have plaques,
Yeah.
you know, accumulating in there. You are more exposed to what we call embolism. You know, the clogging or the closure, by the way, of tiny blood vessels. Blood begins to be occluded. The perfusion of tissues after that blood vessels are being affected. You begin to have some tiny pains, you know, in certain parts of the body, especially even the heart, because the heart contains some of the tiniest blood vessels. It pumps blood everywhere, but itself is being deprived of blood. So some of these steroids, let's call them as they are, some of these supplements are not out to generally help you. There are certain drugs that you take that lightens your complexion. A lot goes on in your system that is killing you. A lot.
So it's no longer the bleaching by cream. Now
It's not even the
abuse.
bleaching by cream. There is bleaching by injectables.
Wow.
Yes. There's a lady, if she hears this, I'm sure she'll be laughing. She has practically done everything. Come and inject me. I said, I can't live with it when you die. She said, I'll die anyways.
Huh.
But at least let me get what I want before I die.
Wow.
Yes. And I said, no.
Sister, under what conditions should I take supplement?
Yeah, supplements, just as the name comes, supplements. You know, our food may actually lack certain things. And you may present with certain conditions that may require you do some supplementation.
Yeah.
Based on what you lack from your day-to-day, you know, food intake, or based on your lifestyle. You know, like apart from hereditary, when you're beginning to develop some white hair like me, I'm still young, a small boy, but with some white, they're like, okay, it seems you are deficient of zinc.
Okay.
So zinc supplementation may help. Your immune system tends to be not really good enough. Zinc can also come into play. You know, so if you don't get enough of it, certain, like some people struggle with some sleep insomnia, It has been linked to the deficiency of magnesium. So you can get magnesium supplementation, which may help you sleep better in the long. So at such instances, you may end up with something like scurvy, which may be due to lack of or deficiency of vitamin C. As simple as that. You can end up with some flu. As simple as vitamin C to boost the immune system a little, you'll be fine. So there are how will I say, there are conditions that warrant you to probably do some supplementation, and you'll be fine. But it shouldn't necessarily become what we see today. It's like a competitive kind of a thing. It's like a class kind of a thing. By the time you get to this stage of life, you can earn. If you earn certain amount of money, you should be able to get supplements around you. No, because it becomes an industry that is making so much out of people in the name of you need. No, you don't have to need. You are not necessarily in need of it because you are rich. If you can take care of these things from your daily intake, you'll be good to go.
Yeah. So as a pharmacist who practice community medicine as well, do you can you give us like a statistic of the cases in terms of the sheer amount of people that come to need certain medication, or the sicknesses that you see that are prevalent within our society?
Well, generally, you can't run away from malaria, typhoid.
Malaria, typhoid.
This is common. In fact, these drugs are sold one of the highest in any environment. Although there are certain environments called community aligned diseases. When you go to a particular community, I can tell you that the general thing you keep treating consistently may be things like ulcer, gastric ulcer, peptic ulcer, duodenal ulcer, ulcers generally. When you go to another community, you discover that, but let's say generally, you see things like typhoid, malaria, hypertension, diabetes, urinary tract infections / PIDs, pelvic inflammatory diseases, urinary tract infections. I think generally this is what you keep finding. There is no day. There is no day in the pharmacy that these diseases will not be treated.
Wow.
Typhoid, malaria, hypertension, diabetes, UTIs, that's urinary tract infections, RTIs, respiratory tract infections, sometimes can be seasonal.
Okay.
You know, the weather is cold, dry, dusty. We treat it now. But it's not as prevalent as the others all year round.
Wow.
And I can tell you, like the UTIs, it becomes worse usually immediately after any festivity. The Christmas, the New Year, the Valentine's.
Why?
UTIs, urinary tract infections.
But why? Why is it tied to this?
No, I mean you have more. In fact, there are sometimes we stock medications based on it's going to be Christmas. A lot of people will have some urinary tract infections.
Wow.
People will come treating infection, the toilet infection. There is going to be more sex.
Wow.
There's usually more sex during festivities. I can assure you, February is coming, right? Give it a week or two. We'll have more treatments for infections.
Wow.
It's a constant. I've seen this over the years.
Wow.
There are certain pills you see people, do you have this? Do you have this? Because they are over-the-counter pills, you know what they are using it for. So you just make it available.
Since you mentioned sex, can we talk about sex, pregnancy control drugs.
Okay.
Yes. How safe are they? Because there are people who abuse them. Generally, yeah.
Yes. Unfortunately, I just lumped everything and I say UTIs. I don't want to
Yes.
begin to sexually transmitted diseases,
Yes.
blah, blah. They're available, they're over the counter, so they can pick it up anytime.
Okay.
So now they don't need to be pregnant. They keep preventing it at all costs. When they need to be pregnant, the system says, no, I'm shut down.
What do you say about hypertension? So there's hypertension, there's hypotension.
There's hypertension, there's
Yes.
hypotension.
Tension.
Hyper,
Up. Hypo.
up,
Yeah.
hypo.
Which one is more dangerous?
They are both dangerous, but I wouldn't want anyone to get hypo.
Hypo.
It can go down and you'll be unable to bring it up.
Okay.
It's difficult.
Yeah.
Just like diabetes.
Are there
Low sugar,
treatments for hypo?
high sugar. Yeah, there are treatments given here and there,
It's
but not as
usually-
effective as the hyper.
because it's usually more of hypertensive medication.
Yes.
You hardly hear of hypertension.
The medications are not so common.
Yes.
The treatment can be symptomatic. But I assure you, whatever goes down finds it difficult to go up.
Wow.
It is easier to bring it down
Then to take it off.
than to take it up. Is it because of the force of gravity working with drugs? So I don't really know. But it's normally easier, to bring it down than taking it up. Like when I tell some diabetic patients, you're not sure if your sugar is high or low, you're to be conversant with don't take your drugs anyhow. Because the more pills you take, you may expose yourself to a low sugar, and that can be deadly.
Yeah. So, I'm wondering, are there any projects you're working on that excites you in synthetic chemistry? Something you like, a big ambition, a big dream.
As I said, I'm a community pharmacist. I'm a researcher. I'm in the academics. Like my present research work is seriously exciting me. Trying to, as I said earlier, making a double barrel. I don't know at what stage I will take it to. It's a hybrid drug. And the discoveries are exciting, are encouraging, but when you think of the supports, it can be demoralizing. But I'm just happy to know. You wake up and you know something. It gives you so much joy. It's an inherent push towards a reason why I need to do more.
Wow.
If this succeeds, I'll be so happy. I'll be glad. So that keeps pushing me. Some of the supervisors try to, okay, you can change. I said, I am swimming in this. I sleep in this. I wake up in this. I walk in this. I couldn't avoid this. When you met me the first, I couldn't avoid not talking about it whenever I don't know how to talk about anything else. Apart from this. But in the academics, being a teacher, being a lecturer in a Nigerian university, it may get you to a point that, let me just get this degree anyhow.
Wow.
So that I can get promoted, so that I will not be stagnant. Yes, this is what happens to so many. I can imagine in a laboratory where I find those machines, as I said, I find these chemicals without waiting for a year to come from China, from my pocket, my hard-earned money that I should feed my family or probably pay my rent, get some light or generator to make myself comfortable. I'm using it to sponsor my own research that will need me to grow in the academics. If I find myself in such an environment, I assure you, I can understand why lecturers outside the shores of this country are happier. Researchers are happier because it is within their reach. It is within their reach. Whatever they want to do is within their reach. This A and B that I'm combining, okay, is it C yet? I can just pick a sample and then drop it in the machine. The machine, oh no, you still have something to do. It's not yet C. Okay, after 1 hour, I can like, okay, let me check again. And then, oh, it shows me, you are soon getting there. Something new is being formed. That's how exciting this thing can be.
Yeah.
And then immediately something new is being formed. The machine tells you something new is being formed, but I can't do it here. So you can see it's a mixture of this excitement. Now I will finish it. Okay, I need to go and check if I've actually done something new. And I'll send it. And I'll need so much money to send it there. How much is a lecturer being paid? And then it comes back. You didn't make something new. I start all over again. Time, resources, wasted. So I'm honestly happy teaching. I think I'm born to teach, to talk.
Yeah.
I love it. I sometimes negotiate treatment with I enlighten you with what is wrong with you.
Yeah.
Then I tell you this is what I intend to do. It's easier. You should go back home understanding what you are doing. Why you are taking what you are taking. Why you are not taking what you are not taking. Why you will feel what you will feel. If you take this, you should feel nauseatic. You need to know.
Yeah.
So that when the nausea comes, it won't sound strange. It won't feel strange.
Yeah. So if you are to change anything in the pharmaceutical industry, especially in Nigeria, one thing that is so dear to you, I know you've talked about access to resources and facility a lot.
Yeah.
If you are to change anything, let's say maybe regarding regulations, something that you think is stifling creativity and stifling the growth of the industry in Nigeria and Africa, what would that be?
Wow. If I'm to change anything, one of the things I think that is stunting our growth, that is stunting and delaying innovations, is the commitment and the steadfastness of releasing resources in that regard. Truthfully. Why am I bringing this word truthfully? Because resources are being released. But can you imagine that Nigeria is sponsoring PhD students to go study Islamic studies? Now, I'm not demeaning Islamic studies, but I'm trying to say, if there's anywhere you need to study Islam at a PhD level in the world, it should be Nigeria.
Wow.
Because of the kind of environment we have found ourselves. Islam is being practiced, Christianity is being practiced, atheists are still here. So where else can you go? At that level. To ensure that we can coexist peacefully. To show that we can communicate and understand ourselves better. It is very possible. Is there any resource we need in that regard that is not found here? I am one person that will use money for pilgrimage, both Christian, Islam, or whatever, push it back to research into science.
Yeah.
I am one person that will advocate for that.
Yeah.
100% of the money used for that. Truthfully use it for research. And I assure you, in the next years, Nigeria will not remain where it is today.
I agree.
The big pharma
that on Facebook
will only come to Nigeria to come and understand what we are doing in our research and beg us. But we are the ones begging them. So we go praying while they go into the lab. And when we finish praying, we'll go and borrow money from them. Am I against prayers? No, I'm a Christian. They pray, they put it into action, whatever God is telling them. They didn't leave the tree where it is. They made books out of it. They didn't leave the fish in the sea. They gave them food to multiply them and then to make even them live better. But what are we doing?
Yeah.
So, I would change seriously the funding, the commitment to research to be used truthfully, and turn around every single kobo from these pilgrims, wherever, down into research and reasonable research.
And I think the pilgrimage board also, I think, was constituted during Go On, when I think they said they had so much money they didn't know what to do with it.
So
they created that. And we are at a point where I have even advocated for things like NYSC to be scrapped because the purpose have been defeated. The purpose was just to make us know each other very well from different regions, but it seems to be reversing the case. And billions, like you said, are being pumped into
the
that.
world is a global village.
Yeah.
We are living in a society whereby if I become a counselor in my street, my son will not attend the same school with yours.
Yes.
So what's the purpose of the NYC anymore? If we are to mingle but in the same environment, we can't even go to the same school.
Yeah.
There's a difference in standard. In fact, the market you go will be different from the market I go to. I would prefer to go to the shopping malls. You can go and bend down and pick your things. So after the NYC, what has changed? The purpose, I think, is defeated. In reality, it's useless. There are those that have no choice on where to be posted to, and there are those that have a choice. So what's the essence anymore?
Wow.
So we are the ones shooting ourselves in the leg, and we are still spending resources in that. To what end? So personally, I feel to no end. Where are we heading to? Just as you said, we were meant to know ourselves. So maybe we know ourselves there, we come back, your father is a senator, you live somewhere else, I live somewhere else, and I can't have access even to you. Not to your school, not to the same market you go, not the kind of food you may even eat, and I can eat.
And we are more divided.
And we are more divided. Much more divided.
Yeah.
Than united.
Wow.
But you see, research, there's always a future to it.
Yes.
Research is tomorrow. Not yesterday and not today. It's tomorrow. You are planning tomorrow. And by tomorrow, you won't be where you are today. So you are making a decision today. Not for yesterday, for tomorrow. What about the pilgrimage? What has it changed?
Doctor, can I call you doctor?
Not yet. In the academics, we give so much credence to let's get this PhD done, and then we can do the doctor thing.
Pharmacist Solomon Naruka, I sincerely want to thank you for this time. It's a privilege to sit down and have this conversation with you. This gives me so much hope that we have all it takes to solve our own problems. One of the things I have heard time and time again is Africans blaming the Western world for all their problems. And you have just shed immeasurable light to where we are slacking personally in dealing with our own issues, and we are only becoming more dependent. Yet we are just insulting. We're not contributing to the solutions of the problems. Listening to someone like you just makes me have more faith and hope that when the right people are put in place, things would take a dramatic turn. So thank you so much for your time, and I wish you the best in your endeavors.
Thank you. And I appreciate the privilege.
Right.
You just gave me an opportunity to talk about what I love. And I can keep talking. If not for other things, we can keep talking. If it is what I love, when you said you may ask questions here and there, this is me. I don't need to check anything to know. It's just me. And I appreciate you. And I hope this helps.
Yeah.
Someone out there.
More than you think.
I pray it helps.
Yeah.
So thank you for the opportunity and the privilege to come here and to interact.
Thank you for watching The Yellow Mic. My name is Kongs Shamaki. I'd like to invite you to help us reach 1,000 subscribers. We are striving to make this worth your time. Also, like this video and share it to your friends, and let me know what you think in the comment section.